So first, everyone who would like to, we need to put on our bonnets. They're right over here. Bonnets.
Anybody want to put on?
Anybody want to put on the
Here's your caps and gowns, guys.
We're
getting the surgery.
You gotta put your surgery hat on. You don't want hair inside your surgery hat.
And we're going to put on our little mask.
Adults, if you want it, you can have it too.
Anyone who wants to.
Anybody want a mask? You want a mask? A mask?
You're not going to do that.
No.
We're good? Don't forget your gloves.
All right.
We have to turn around.
Anybody need
We're gonna
help?
get a little nose.
Oh, we got a good surgery over here. You don't have to.
What, you're too cool then?
All right.
No, I just don't feel like
All right, well, you guys are getting settled with that. So
pulled it
before
right off
we
your
put
nose.
any of your pets into surgery, we have to put on our caps so we can make sure our hair doesn't get into the surgery field. And then we put on our masks so we can cover our breath and our speech, essentially, okay? There's also gloves that you guys can put on to keep your hands nice and clean. We want this all to be as sterile and as clean as possible so no one gets infected, okay? So what we do is we give them a few injections to make them sleepy, right? This is Bella. She's going to be our female dog today, okay? So when Bella's nice and sleepy, we'll carry her to this table, and then Kasara will place a catheter in Bella's arm, okay? We shave the fur for that so we can make sure that we get directly to the skin, because we all know our pets are very hairy, right? So if we place the catheter without shaving it and then we put the tape on, it can be painful. All right, so Kasara's going to place the catheter if you guys want to watch this. Essentially, she just twists it off. There's a little, or I should say a big needle, all right? And we want to put that inside of the vein. Yeah. All right. Once the catheter is placed, right, ideally we would have a patent vein there, so there would be a little bit of blood. We'll tape it in with tape. And we really need to make sure that's taped in very securely so when we're moving the baby around, it does not fall out. Okay? After the catheter is taped into place, we give essentially what we call an induction agent, which is the only propofol, is the only white fluid in veterinary medicine that goes within the vein, which is really cool. That's going to make sure that Bella is very, very sleepy and not aware of anything that's going on. Yep. All right. So for the people in the back that can see, that's what that looks like. Kind of, right? All right. And we're going to pretend that we gave the propofol and that Bella's now very, very sleepy. So once Bella's not aware of what's going on, we have to make sure that she can breathe appropriately. So we establish an airway with an endotracheal tube. Okay, so this tube will go in her trachea, and essentially she'll breathe out of that. The bottom of the tube here has a little cup or a balloon that we have to inflate to make sure it's secured in place. My job as Kasara's assistant will be to hold Bella appropriately so she can find the trachea and put the tracheal tube inside.
Very good patient.
Yes.
The best.
Drugs.
This is actually how they are when they are after they're giving the propofol. So then we secure the endotracheal tube in place by tying the string around the puppy's head. Again, we just want to make sure that nothing is falling out with all the movement, right? Then we want to put the dog in a position that the surgery is going to be in. So Bella's going to get a spay today. So essentially we're going to take out her lady parts, okay? To keep her nice and healthy. So we'll put her on her back and then we'll hook her up to our anesthesia machine. So the machine is pretty complicated, but in simplifying it, it basically keeps Bella asleep because the propofol that we gave, it works quickly in knocking them down, but they also can pop right back up. So we need to make sure that they're on the gas so they stay asleep and they don't feel anything that's happening, right? We blow up that bulb that I showed you at the end of the trachea to, again, just ensure that it's in place. And then we lube the eyes because we want to make sure there's no ulcers present and they can't blink on their own right now because they're completely asleep. So once that's done, Bella's ready to be monitored. So we have a few different things here. This is a monitoring machine. It does the EKG, which is essentially we monitor the heart rhythms. Okay, we monitor how much oxygen is moving in and out, and we hook that up with these equipment here. So this is for the heart. Each of these has basically letters on it that tell you which leg it's supposed to go on, or in vet school we had like acronyms to remember the colors because they're always the same. But if you ever forget, it says left arm literally on the on the equipment. We also have to measure her blood pressure. So she's a big dog, so we needed a big blood pressure cuff, but it needs to be half of whatever the leg is. So they vary in size. There's a few here that you can see hanging from the wall. And then we also measure the oxygen or the pulse ox. Now, since Bella's pretend, it's not going to show up, but you can put it on your finger and it will give you a number up on the screen here, which will give it a moment to hopefully Kasara's alive.
There it is.
All right, there she is. 100% oxygenation, thank goodness, right? So usually we put that on the tongue of our puppies, but there's other places you can put it. Basically, you want to put it where there's not as much fur and it's skin to skin. So we actually like them to stay in the 90s, but we can see them go down to like 85. If that's the case, then we adjust our machine. So
Anything between 95 and 100 is where we like them to be.
So then after that, Kasara would shave a window, right? So we're doing a spay, so we have just a little square on the belly here that we shave. We're not going to shave Bella, she wants to keep her fur, okay? And then we scrub her. We use chlorhexidine and alcohol to make sure she's nice and sterile. After that, ideally we would move the patient into our surgical OR suite, but because we have to keep that very, very clean and very, very sterile, we're just going to pretend we transported in there while we're still out here, all right? At this time, it would be great if you guys are interested. I see some of you already started. If you can put on your gowns, that's what we have to put on to go into the OR. We put on like we already said, we have our hairnet on, our bonnet on, we covering our mouth. We also put on little booties on our feet because we don't want to track in whatever we had outside into the OR. And then we put on our gowns so that we're all covered up and all sterile as possible. For the actual surgery, once we get in, we'll scrub it one more time. We're going to be really, really sure we don't get any type of infections, okay? So we scrub it one more time, and then I come in all gowned up. I look like this when I come in, and no one can touch me. I have to be the most cleanest, sterile person in the room. We'll just make a linear incision. We'll take out the lady parts, close it up, and then we're done. All right? So that's really what we do here. After the surgery, of course, there's a recovery process where we get her unhooked from all this equipment. We make sure she's swallowing and awake. And you know, sometimes we trim the nails, a little mani-pedi and a little ear clean. And then that's it. They hang out with us for the day. All right, any questions?